Hello, everyone. Thank you for joining us today at our virtual reality Naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2020 at CACA's National Leadership Forum. We engage with many of our amazing coalitions to learn how communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, create a training around it, and add it to trainings that are already being held. To date, we've held almost 20 virtual screening events, engaged thousands of participants, and we look forward to hosting more events in the coming year and engaging countless new participants. Today, we are thankful for you, our amazing CACA members and guests, and would of course like to express our gratitude to our partners at the Seminole Prevention Coalition for their partnership in creating this event and for hosting us today. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in Florida who are working every day to save lives. We are honored for them to be part of this event. Then we will review a virtual reality simulation developed by Walmart that demonstrates a few scenarios on how to recognize when an overdose is happening and how to administer naloxone. From these events, we plan to learn how to use this technology to better save lives and create a norm that every life is worth saving. Now, I am pleased to introduce our first speaker, CACA's Chief of Staff, Valentino Murphy. Valentino joined our team in 2021 and has been working ever since to help further CACA's mission of building and maintaining safe and healthy drug-free communities. We are thrilled to have him with us at CACA and appreciate him being here today to speak with us. Valentino.
Thank you so much, everyone. I'm thrilled to be here for this very important event. First and foremost, I want to extend my heartfelt gratitude to Walmart. Their commitment to investing in this technology, and more importantly, in the people whose lives will be positively impacted by this life-saving training, is truly commendable. I'd also like to extend a special thanks to our friends and supporters at the Seminole Prevention Coalition. I consider it an honor to be on with such impressive leaders from the great state of Florida. Finally, I want to thank everyone on today's webinar. CACA has a footprint in over 30 countries worldwide and more than 5,000 coalitions across the United States. We seek to train community residents and leaders to build and develop coalitions in their communities and reduce substance misuse by adapting CACA's model for community change. CACA knows that the prevention of substance use and misuse before it starts is the most cost-effective and cost-efficient way to reduce substance misuse. It's important to emphasize that prevention is more crucial than ever before. Recently, the CDC reported that over 109,000 drug overdose deaths occurred in the United States in 2022. This number may have leveled off since we experienced the highest number of overdose deaths last year, but there is still plenty of work to be done, and the CDC anticipates this number to rise as data comes in. To put it into perspective, that number would fill Amway Center over 5 times. It's a tragic reality, and we must do everything in our power to address it. Together we are stronger, and as we train substance use and misuse prevention to coalitions every day of the year, all across the world, it's crucial that our leaders have community stakeholders like yourselves fully engaged and committed. You are true heroes in our communities, driving positive change. We need to continue to raise our voices on this in unity. Our partners at the Drug Enforcement Administration launched their One Pill Can Kill campaign, which aims to raise awareness about fentanyl-laced pills that are killing so many fellow Americans. DEA's message then is still the same now. If you did not receive your medication from your licensed pharmacist, do not take it. We have seen what one pill laced with fentanyl can do, and we do not need to see any more lives lost. As DEA Administrator Ann Milgram shared at CACA's 2023 National Leadership Forum to over 4,000 coalitions. This is not a war on drugs, but a fight to save lives. We also need to be vigilant on trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine as a key emerging threat and is one of which interacts with opioids in a devastating way that leads to overdoses. An example of the spread of this dangerous trend, some cities are reporting that drug samples they are receiving rarely contain heroin, while 99% of them contain fentanyl and 4 out of 5 samples contain xylazine. In this current landscape, we need everyone available to save lives and help our communities recover from these drug crises. So keep up the exceptional work. Thank you for having me on.
Thank you for those remarks, Valentino. We appreciate you joining us. And now it is my pleasure to introduce our co-host for today. We are excited to introduce you to Dr. Todd Husty. Dr. Husty is board certified in emergency medicine and is the lead physician overseeing medical record review, physician education, and the daily operations of Medical Audit Resource Services, also known as MARCI. Dr. Hussey has been performing clinical record reviews since 1982 and has been providing physician document improvement training since 1987. He is considered an expert in documentation for diagnosis-related groups, ambulatory payment classifications, emergency medicine, inpatient versus observation, and risk adjustment. Dr. Husty has served on and has been the medical director of multiple hospital committees, including quality assurance, risk management, medical executive, utilization review, and health information. He has also served as chairman of departments of emergency medicine. Dr. Husty served as the medical director and physician advisor of utilization review for many hospitals in Florida, California, Wyoming, New Mexico, and West Virginia. Dr. Husty is a nationally renowned speaker for American Academy of Professional Coders and the American Health Information Management Association. An associate professor and clinical preceptor for the University of Central Florida College of Medicine, Dr. Husty's area of special interest is the direct correlation between the quality of documentation with the quality of care and reimbursement systems. We turn it to you, Dr. Husty.
Hi, I'm Dr. Todd Husty. I'm the medical director in Seminole County, Florida, and also at the city of Mayland, which happens to be in Orange County, Florida, right next door. Been doing emergency medicine work for over 40 years. I don't know how much longer I get to do that, but it's been wonderful. Probably one of the most frustrating things that we've done in emergency medicine, medical services, EMS, is the whole problem with opioid addiction and overdoses. So they came out with Naloxone, and the intranasal spray, and Naloxone has been it saved lots of lives. So how does it work? Naloxone is actually an opioid. I mean, it sounds kind of weird, but yes, we're treating people who are opioid addicted with an opioid. So you got to know how these things work. Is for an opioid to work, it needs to glom on to receptors in your brain that are responsible for things like pain, but they're also responsible for things, kind of important things like breathing. And if you get enough of your receptors coated with fentanyl or other opioids, yeah, you'll get all numb and fuzzy, and you won't have pain, and you'll forget to breathe. And that's where the death comes in. So when they came out with intranasal Naloxone, we've used Naloxone for years in the EMS and emergency medicine. We can reverse, if we give somebody too many opioids accidentally, we reverse some of it. So they remember to breathe. And that happens. I mean, you don't know each individual. So what dose is the correct dose? So we've used it for 30 years. So we're pretty familiar with it. But then law enforcement started using it. Civilians started using it. If you really push and you try to make sure that it's really available for places and people that might be opioid addicted and right now totally they've forgotten to breathe because they've taken too much opioid, either usually not on purpose. Usually it's an accidental overdose because they didn't know that the opioid that they just bought on the street was so strong. But if you really push and you have it around, in Seminole County, Florida, we just got last year's figures back. We decreased opioid deaths by 11.5%. 11.5%. I mean, it sounds so wonderful. Well, the other side of opioid addiction and treatment is that we still have a long ways to go. That 11.5% is wonderful, but look at the rest of the opioid overdoses that we have not been able to get to, and we still have deaths in our county. So naloxone should be available for everybody. I mean, quite frankly, it's interesting is that naloxone, I just said, is an opioid that has it doesn't do anything to you. It doesn't make you warm and fuzzy. It doesn't make you to forget to breathe. You can basically give it to anybody and it will not have a side effect. That makes it a pretty darn good drug in our book, is that if you're not sure, somebody's lying on the ground, they're not breathing, what do? Well, you know to call 911, of course. Get some help. And if you have naloxone, you administer naloxone. You can see if it's starting to work. In Seminole County, we have sort of added on one other piece, and that is if they're not breathing or they're breathing very shallow and turning blue, that you can do CPR, not mouth to mouth. No, we're not talking about mouth to mouth. We're talking about on the chest. Because when you press down on the chest, you push air out of the lungs. When you release, air sucks back into the lungs. You actually move air through CPR. So we ask our folks to administer naloxone, call for help, administer naloxone, and do chest compressions, because that will help them move air until the naloxone goes in and displaces all the bad opioids, because it's so much stronger than the other opioids, and it'll go in and have no effect on their brain. It'll make the other stuff go away. Pretty cool stuff when you get right down to it. The whole concept of being able to administer a drug, the public and law enforcement and other people being able to administer a drug is a little scary, except for the fact that naloxone has no side effects. So you're not going to hurt them by doing this. The worst thing that happens when you administer naloxone is the person wakes up and they get pretty irritated. Now, people say, oh, it ruined their high. No, you actually put them into acute withdrawal. They're in an acute withdrawal situation. So they're shaky and they're sweating and they're irritable, but it's not because you ruined their high. It's because they now are used to having their receptors coated with fentanyl or whichever drug, and now it's gone. So, and when it goes, they go into acute withdrawal. So there is a drug called buprenorphine, which we're starting to administer more in the field, which then recoats those receptors, gets them coated, and will last for longer, last for 12 to 24 hours. And it has no effect. It does not get anybody high. You can't get high on buprenorphine. So we've started adding that into what we do is they get naloxone, and then we try to get them to get on buprenorphine, which they can take every day and never have to use an opioid again. So it's a comprehensive plan. We're still working it out. We've been working very hard on it. Yeah, 11.5% improvement. Great. Got a long ways to go. So thank you very much for listening and for being interested. You can help save a life. I mean, you really can. So I think that if you're in a situation where you might ever run across somebody who is lying on the ground, not breathing, turning blue, you give them naloxone if you have it available. By the way, if they're having a heart attack or they're just had a stroke, it won't make that any worse. And that CPR part, they're having a heart attack, they might need CPR right now. So call for help, administer naloxone. We believe that you should be doing CPR also. And if it's not working, give them some more naloxone. Can't hurt them with more. And be with them until help arrives. Thank you for your interest. And hopefully you never get to use it. But if you do, you can save a life. Thank you very much.
Thank you, Dr. Husty, for sharing your expertise and for your tireless advocacy for improved care. Next, I would like to introduce Paula Kohler. Paula is the manager for the Office of Health Promotion and Education for the Department of Health in Seminole County. Prior to her current position, Paula served as the lead for the COVID-19 hotline, the COVID-19 data team, and the program coordinator for implementing overdose prevention strategies at the local level. Paula has been working in the public sector for over 25 years. She began her career as a public school teacher and administrator and continued that profession for 20 years. She received her master's degree in educational leadership from Nova Southeastern University. She is an active member of the Florida Public Health Association, the National Association of County and City Health Officials, and the American Public Health Association. Paula, we look forward to hearing from you.
Hello, my name is Paula Kohler. I am the manager of the Office of Health Promotion and Education at the Florida Department of Health in Seminole County. Just kind of wanted to talk about our response here at our department to our opioid epidemic in Seminole County, Florida. We actually started off very slowly. We started off just attending some of our opioid council meetings that our sheriff's department had created, and that kind of led us down the road to getting a grant through NACCHO to actually try to leverage partnerships so that we could make an impact on what was happening here in Seminole County, Florida. So we were able to apply for the grant, got the grant, and started working with our sheriff's department because they had at the time 2 deputies who were solely responsible for responding to non-lethal overdoses. And so our partnership with them started with meeting with them weekly, talking about who was having these overdoses, and then having us respond to those individuals so that we could break down any medical barriers that were preventing those people from moving down the road to recovery, and whatever that road to recovery looked like for that individual. So, and it has since grown so much. I'm so pleased with the progress that we've made. Our weekly meetings have grown to include peer recovery specialists in our meetings so that they could help respond with individuals who've had an overdose. We've actually included an agency that offers MAT treatment, and we do that here at the Department of Health. And so people know that they can come here once a week to get that assistance so they can stay on that road to recovery and do what they need to do to help themselves. We're very excited about that. Our biggest challenge when we first started was that we did not have naloxone. We didn't have access to it, even though we were on the front lines responding to people who very clearly had a substance use disorder. We didn't have it. But our health officer at the time was relentless and led the charge for the departments of health in the state of Florida to be able to have naloxone. So we actually have that product here, and we are just doing whatever we can to get it out into the community because we understand how much it saves lives. We offer it at all of our community outreaches. We bring it to community meetings. We have people come here to do trainings. We're doing trainings with churches. We even have a training scheduled with the League of Women Voters. So we're trying to make it known as much as possible so that it can save lives. And we just feel passionate about that it's just so very important. So we're excited about what we've done, but we know that the work is still there. We still have so much more to do to make an impact here in this epidemic that we are experiencing. So I'm so glad to be able to share this information with you. If you're ever in Seminole County, come on by the Department of Health, and we would love to be able to talk with you and offer you some naloxone to take home with you.
Thank you, Paula. Your leadership on the Opioid Council and your work in bringing in such public health leadership to Seminole County is invaluable. Next, we will hear from Dr. Scott Tucker. Dr. Tucker is the clinical director for Advent Health Hope and Healing Center, the Behavioral Health Navigation Team, and the Outlook Clinic. He completed his undergraduate degrees in psychology and criminology at the University of Florida and has since earned his license in mental health counseling and a doctorate degree in psychology. Dr. Tucker brings over 25 years of experience in the field, working with Advent Health and the surrounding community. He builds stronger networks of services to assist those with mental health and substance use disorders. When not working, he enjoys spending time with his wife and twin boys. Dr. Tucker, please take it away.
Hello, my name's Dr. Scott Tucker. I am the clinical director for Advent Health Hope and Healing Center. I also have the substance use disorder navigators in the emergency departments, and I have the Outlook Clinic in Orlando. I'd like to talk to you a little bit about today, the services that we offer and what we do here at Advent Health for substance use disorder. A lot of times when individuals would come into the hospital, whether it be an overdose or another illness, and they're getting treated for substance use disorder, a lot of times what would happen is they'd come in, they get treated for the physical symptoms of what's going on, but not the behavioral symptoms that are going on. So a large portion of what Advent Health does is we want to treat the whole person. So we believe in whole person care. And I think that a lot of that has to do with the behavioral health aspect of the individual. So to help with that, what we did was we created a service line of substance use disorder navigators that sit in our emergency departments that help individuals that have substance use disorder. So part of that is when they come in, the physicians will put a consult in for that team and they'll go meet with them. And then after they do, they're really determining a level of care, what's needed. They're meeting the person where they are. So once they have that determination, they're able to give those kind of resources to those individuals and be able to get them to that appropriate level of care. While that was going on, Sheriff Lima here in Seminole County came to our CEO, Tim Cook, and said, we have an opioid epidemic going on, and we really don't have the resources here in Seminole County to fight that. And what we'd like to do is partner with Advent Health to create a treatment center for those individuals that have substance use disorder. So the inception of the center really was a partnership between Seminole County Sheriff's Department, the Seminole County Commission, and Advent Health. And really the purpose was to meet a problem within Seminole County. So we opened up a residential treatment program that's 30 days long, where they go through 10 hours of therapy weekly. They have individual therapy, they have group therapy, they have family support for that. And it's really focused on relapse prevention and how to give them the tools that they need on their road to recovery. The second program we have here is an intensive outpatient program. It's 3-hour groups and it's attended 3 days a week. So that's focusing on mindfulness, coping skills, and how to manage the triggers of those individuals as they are on their road to recovery. And really practicing wellness and self-care. That program is a 4 to 6 week program. However, it's going based on a treatment plan. So whatever the need is, we'll do that. We were able to use our hospital system as the front door to a Hope and Healing Center. And so as they came into the hospital, the behavioral health navigators, substance use disorder navigators would meet them. They'd assess for appropriateness to come out here. We have peer recovery specialists that collaborates with those navigators to ensure it's a good fit for Hope and Healing Center. And then, they'd be sent over to the facility as far as that kind of stuff goes. So with that partnership, we found that we have a larger impact with the community when it comes together as a whole. Advent Health isn't the agency that's trying to provide everything, but we are able to, through those partnerships, have a lot of buy-in and support from the community so that we don't have to reinvent the wheel, and the community agencies can provide whatever their expertise is. So we have a lot of community partners that will come in and they'll do groups. We have Yoga for Change that comes in and does yoga classes, and we have Christian Help that comes in and they do resume building and teach them how to do interview skills and explain gaps in employment and things like that. We have Fifth Third Bank that comes in and does financial classes. We have Central Florida Arts that comes in and does music therapy. Meals on Wheels comes in and provides the food for those individuals. And we partner with Recovery Connections of Central Florida, which is a peer-led group that helps us upon discharge and things like that. And then our partnership with the Seminole County Sheriff's Department gives us access to our SCORE team. So that's the Seminole County Opiate Response Effort that is led by the Seminole County Sheriff's Department. They're uniformed deputies that act more as social workers than law enforcement. So they come in and they do groups every week, and they teach them what those resources are and how to get a hold of somebody at 3 o'clock in the morning if their recovery is in jeopardy. So really it's that combined effort of the community that is able to give us such success. So our first year, we opened in March of 2021. Our first year for success for residential was a 63.95% in 2021, where the national average for short-term residential is 54%. So we, well exceeded the program completion rate on the national average. For IOP, it was 57.14% on a 26% program completion rate. Our second year, those statistics jumped to where our residential successful completion rate was 68% and intensive outpatient was 73%. And really that is because of all of the partners that are coming together, working as one to ensure that we're providing good care to those individuals that need it most. To where if you look at the national statistics for overdoses and overdose deaths, you're going to see a rise in both of those statistics across the country, where in Seminole County, those statistics are decreasing. So year to date, there is 11.5% reduction in overdoses in Seminole County. And part of our strategy to help with that is the ability to have all of the partners that are working towards the same idea for that individual. We're not working as separate entities, but we're working as one. In the hospital, when somebody comes in, we're able to provide Narcan for that individual before they leave. And from the center, we're able to do the same thing. So, we all understand that relapse is a part of recovery. And with the fentanyl crisis that's going on, it could be in anything. So regardless of whether opiates is your drug of choice or not, it could be cut or mixed into any one of the drugs that they may be taking. So, when you think that you're recreationally using cocaine, it's possible that that was cut with fentanyl. And a lot of times, that's done because the drug dealers are looking for that dependency. So it really is an epidemic in what's going on, and it takes an entire community to bind together to ensure that we can all do the right thing for our communities and help those individuals that are struggling so deeply. Here at Advent Health, we are ever expanding our programs and making sure that we can meet the behavioral health needs of individuals, whether that be mental health or whether that be substance use disorder. Most of the time, those go hand in hand. So, you're really looking at the behavioral health needs of those individuals, and it's been an honor, and it really has been a very unique partnership that we've been able to have with the Sheriff's Department in Seminole County, and then all our partners as we continue to grow and provide those services for individuals. So, I really do appreciate being able to be here today, and it's my honor to be able to provide services for Seminole County and those residents that we are able to help gain the road to recovery. So, thank you so much.
Thank you, Dr. Tucker. Your work is critical to making these services accessible and successful for those you serve. We're also looking forward to hearing about your success in your new second location that's opening in partnership with the Sheriff's Office. Please do keep us up to date. Today, we are also joined by Dr. Anthony Maldonado, the lead clinical pharmacist for Bueno Pharmacy Clinic. Dr. Maldonado has been involved in the industry for over 18 years and has made it his mission to help close the equity gap by improving the accessibility of healthcare in the communities he serves. Dr. Maldonado is constantly looking for ways to serve others and promote health and well-being beyond dispensing prescriptions alone. Dr. Maldonado, we're looking forward to hearing from you.
Hello, everyone. My name is Dr. Anthony Maldonado. I'm the lead clinical pharmacist with Bueno Pharmacy Plus Clinic. I want to thank you for your time and having me speak here in this platform, just about me, the organization I work for, and what our mission is. I became a pharmacist back in 2015. I have a strong passion for being able to provide or improve the accessibility of medications. I grew up without health insurance. I know firsthand what it's like to not have access to medications when you actually need them. So that's kind of like the driver of what has taken me to where I'm at today. When we started Bueno Pharmacy, we noticed that there was a lot of patients in the area, again, just needing medications, they just don't have access to a doctor. One of the things that really caught my attention was the fact that there is a lot of patients coming to get syringes. Nobody in the area wanted to provide syringes to these folks. So we just jumped on it and kind of saw the opportunity and see like, how can we help improve? It has led us to where we're at now at this point as a small pharmacy in the Sanford area. We are just being able to provide, we have grown this program to be able to provide clean syringes, fentanyl test strips, alcohol swabs, and now, thanks to a partnership that we have with Recovery Connections of Central Florida, along with Seminole County, we're able to provide medication-assisted therapy, which typically includes the buprenorphine or the combination of the buprenorphine with naloxone. This program is great, and it's 100% free for all of those folks in the Seminole County that actually want to go on board with the recovery process. I strongly encourage everyone in the Seminole County area to reach out and to ask questions about this program. Again, it's 100% free, which is amazing. We always hear stories of patients that they were spending hundreds of dollars with a prescriber and then having to go to the pharmacy, spend a couple of $100s more just so that they can stay sober, which is outrageous. Thanks to this program, we're literally changing lives every single day. And yeah, honestly, I encourage everyone to reach out and see how they can join. So on the clinical side, to prevent misuse, as a pharmacist, I see medication misuse almost on a daily basis. Trying to sum up of all these different scenarios and kind of sum it up in three, I have a couple of tips here for you. Number one would be to educate yourself as much as possible. And when I say educate, I encourage you to educate not just on the medications that you're taking, but also the condition that you currently have to why they're prescribing that medication. It is critical. It is a critical first step just so you know how to manage it and what to do, right? The second tip I will have is stick with your treatment plan. prescribers or your clinician, they go over, right, all these labs, your MRIs, your history, just to come up with that prescription. Um, and know, like, okay, you're supposed to take it every such, let's say if it's Percocet, right, for your pain, you're supposed to take it every 12 hours. I hear these stories all the time as a pharmacist. Oh, I had a little bit more pain, so I had to take an extra one. That is something that I will discourage. I do. Please don't do that. Always stick with your treatment plan. There's a reason why it's there, and always reach out to your pharmacist or reach out to that prescriber, just so that what should be your next approach if your pain is not well taken care of. But that applies to pretty much all conditions, right? Just stick with the treatment plan. Always ask that prescriber what that treatment plan is so you can follow along and you are on the road to feel better and get better. The third tip I have is to never ever take a prescription that was not prescribed to you. Like I was mentioning earlier, right? The process of being able to write a prescription goes through your lab values, your personal history, your social economic factors. There's a lot of things that go into it for that prescriber to actually write that prescription. The fact that you're taking a prescription that was not for you, you're skipping all these steps and just putting you at harm's way. I would suggest that in the event that you are in pain, for example, or you are in need of a medication, there's several tools, at least in this area, several clinics that are nonprofit that will help you get those medications. And again, just try to avoid taking a prescription that was not for you. Thank you very much for having me here on your call. This was great. It's such an honor to be able to work along the sign with a group of folks that really want the best, and it's always to help prevent these unfortunate deaths. Thank you very much for your time.
Thank you, Dr. Maldonado. The only way we can make progress on educating everyone and changing our community's health outcomes is through champions such as yourself who are working to break down barriers and taking time to reach each member of the community. And now we're so lucky today to be able to hear from today's host and longtime CACA member, Debbie Owens, who has tirelessly led the Seminole Prevention Coalition as executive director since 2009. Leading the coalition, Debbie secured and oversaw 10 years of drug-free communities grant funding for the coalition. And with that grant alone, brought in more than $1 million to support prevention activities in Seminole County. Debbie also serves as the board secretary for Central Florida Care's Health System and board chair of the Healthy Start Coalition of Seminole County, as well as a board member of the Health Council of East Central Florida. She is also an active member of other communities working to provide a safe, healthy, and drug-free community, including the Seminole County Children's Cabinet, Seminole County Tobacco-Free Partnership, Florida's Association, Don't Let Florida Go to Pot Coalition, and Project Opioid. Debbie graduated from the University of South Florida with a Bachelor of Science degree and began her career in education. Debbie spent 35 years as a teacher and dean of students, with most of those years in Seminole County before she became an active member of the prevention community. She is passionate about providing the community with the necessary education to make smart decisions in the areas of mental and physical health and substance use. Debbie, we are so excited to hear about your work.
Hello, I'm Debbie Owens, Executive Director, Seminole Prevention Coalition. Our coalition is partnering with CATCA to host this webinar to educate our neighbors about opioid overdose prevention and response, with special focus on naloxone, so that we can show the range of resources and opportunities available for the Central Florida community. We want to thank our featured speakers for presenting some of these programs that our community members are working on in the field of opioid overdose prevention and recovery, and also a training video covering the use of naloxone provided by Walmart. Special kudos to Walmart for supporting this worthy cause throughout the United States. Another special offering for attending this webinar will be a box of naloxone at no cost to you. Requirements will be for you to sign in with your name and email address. After the webinar, you'll receive a list of dates and locations where you can pick up free naloxone. Special kudos to Kelly Welsh from Seminole County government for providing this free naloxone. Here's a little about our coalition's involvement in the county. We are a not-for-profit 501c3 organization that exists to build a healthy, safe, and substance-free community in Seminole County. As a coalition, we unite local organizations, businesses, agencies, and individuals for the achievement of a common goal. Our efforts result in an improved quality of life in our community and across Central Florida. We've received our first drug-free community grant funded by SAMHSA in 2010, and we were very fortunate to qualify for this grant funding for 10 years ending in 2020. Such topics relating to this grant are underage drinking, marijuana use, tobacco, vape use, prescription drug misuse, and other priority areas. Designed specifically for substance misuse, Seminole Prevention Coalition created the Pitch Your Pills campaign to combine with the Lock Your Meds campaign, sponsored by Informed Families, the Florida Family Partnership. Did you know that 44.9% of misused and medications come from family and friends, not a stranger, a drug dealer, or the internet? Many adults may be unintentional suppliers, and awareness is the key to ending this preventable epidemic. The next step for our coalition was to find ways for the community to pitch their pills, rid their homes of these unused and unwanted medications. In partnership with all 8 law enforcement agencies in Seminole County, the coalition shared the cost of purchasing 11 permanent drop-off boxes located in each law enforcement agency. Our county has participated for the past 12 years in the National DEA Take-Back Days held in April and October of each year. Seminole County is proud to say that we have collected over 48,000 pounds of medication over the past 12 years. Our coalition has also partnered with the DEA One Pill Can Kill Fentanyl Prevention campaign with providing 15 community vehicles wrapped with the fentanyl prevention message. Along with the above campaigns, we are fortunate to work with CADCA and DTERA a few years ago during Operation Medicine Cabinet to provide a community over 10,000 drug deactivation systems in environmentally friendly pouches. The coalition has continued the process of providing these free disposable medicine pouches to date. Our current project is concentrating on spreading the naloxone prevention messaging and providing our community with easy access to naloxone. Thanks so much for attending our webinar. We hope that this information we have provided is helpful to you. Please share this information with those you feel will benefit from it. And don't forget to sign in with your name and email to receive your free naloxone kit.
Thank you, Debbie. And a special thank you for all your work building up to today's event and for bringing together so many fantastic voices from across the county. We are grateful for each of our speakers today, together doing so much to raise awareness and expand services in this challenging environment. And now we will view the virtual reality simulation portion of the event. Walmart has invested in training their associates, which includes the use of virtual reality. The virtual reality program was developed as a tool to build skills in unique training situations that are hard to replicate in a classroom setting, such as front of store shopping experiences and emergency preparedness simulations. This technology led to the development of non-retail trainings, such as the VR, which we will see next.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These 2 industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Dude, are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of Naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you'll see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me.
All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing this powerful tool. We are so excited to work with you and to connect this with community members. And again, thank you to all the speakers here today who have taken this time to be part of this event. We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. Please reach out to our team, Reiko Mendoza, Sean Moore, or myself, Mia Wallace, anytime with more suggestions and questions. We look forward to discussing this more and getting your tremendous feedback. And thank you to the Walmart team for developing this powerful tool. We're so excited to work with you to connect this with community members. And finally, thanks so much to our friends at the Seminole Prevention Coalition. We have added their websites to the chat box. Please visit them and learn more about the amazing work they are doing. We are now through the hour, and we will conclude the webinar. I wish you a great rest of your week. Thank you.